Hello everyone, my name is Jordan Smith and I'm a junior at Wilmington University studying to get my bachelor's degree in behavioral science. In 2017, more than 72,000 people died from drug overdoses in the United States. However, two-thirds were linked to opiate use. Do you know someone who has either died of an opiate overdose or struggled with their addiction to opiates? Doctors have overprescribed opiates at an alarming rate. As a result, this has led individuals to becoming addicted to opiates and turning to heroin. The prescribing habits of doctors are directly associated with the opiate epidemic in America. Hence, doctors have responded to the problem by reducing the non-medical use of opiates, but ignoring the medical use of opiates. Doctors must respond to the opiate epidemic by taking a compassionate approach that addresses both the medical and non-medical use of opiates, thus decreasing the high levels of death associated with opiate use and/or abuse, in addition to preventing the transmission of diseases. As a recovering addict and a college student, the opiate epidemic in America deeply disturbs me. Thus, it requires numerous solutions to end the problem. My speech will cover an overview of the opiate epidemic, the association between doctors and patients, and recommendations to end the opiate epidemic in the United States. Between 1996 and 2002, Purdue Pharma funded more than 20,000 pain-related educational programs and launched an all-around campaign to encourage the long-term use of opiates. Now, I want to show you something from the National Institute on Drug Abuse, which details the number of deaths involving opioids. Now, as you can see, this is a bar chart graph depicting years 2002 to 2017. In 2017, there was a total of 49,068 people who died from an opioid overdose in the United States. This bar chart graph represents a 410% increase in the number of opioid deaths in the United States. That is substantial and shocking. Purdue Pharma provided financial support to the American Pain Society, the American Academy of Pain Medicine, and others. In turn, these groups all advocated for more aggressive identification and treatment of pain, especially opiate pain relievers. The American Pain Society and the American Academy of Pain Medicine instructed prescribers that the risk of addiction intolerance was low, risk of opioid-induced respiratory depression was brief, and worries about drug diversion or abuse should not affect opiate prescribing practices. To overcome the fear of opiophobia, fears about prescribing opiates, physician spokesperson for opioid manufacturers claimed that the medical community had been confusing addiction with physical dependence. They even described addiction as rare and completely different from physical dependence. Doctors, the media, and others characterize the opioid epidemic as a problem of non-medical opiate use by adolescents and young adults. However, opioid overdoses appear to occur more frequently in medical opiate users than in non-medical opiate users. From 1991 to 2011, consumption of hydrocodone more than doubled, and consumption of oxycodone increased by approximately 500%. During the same period of time, the opiate pain relief overdose rate nearly quadrupled. And going back to my bar chart graph from the National Institute on Drug Abuse, you can see that in year 2011, how much the number of deaths involving opioids increased from 2002 to 2011. That represents a substantial increase in the number of opioid deaths from 2002 to 2011 compared to now, 2017. So what does this tell us? This tells us that doctors still have more to do to prevent opiates from getting abused or misused. To prevent the non-medical use of opiates, doctors and the public focused on a law enforcement approach to prevent opiate medications from getting in the hands of non-medical users. States responded by instituting state prescription monitoring programs and prosecuting any unlawful possession, sale, or distribution of opiates. Although the number of new non-medical users has declined, overdose deaths, addiction treatment admissions, and other adverse public health outcomes have increased dramatically since 2002. Over 10 years or more, states and federal leaders have tried to reduce the use of opiates by allowing access to opiates for pain patients, while limiting the non-medical use of opiates. However, the levels of morbidity and mortality worsened in most states. In addition, most heroin users express that their opioid use started with opiate medications. Because of the increase in the number of prescriptions written and dispensed, advertising from pharmaceutical companies, favorable public opinion on opiate medication use in the past, society accepted the use of opiates in the U.S. Therefore, the public and patients did not question the validity of their doctors' prescribing patterns or the consequences of taking opiates. Doctors and the public were duped into believing that opiates were safe. If a patient is caught abusing their opiate medications, they are terminated from treatment without any direct connection to treatment. Doctors must connect patients who abuse their medications directly to treatment. Doctors must institute strict rules for assessing and prescribing opiates, limit the supply given to patients, and be required to take classes on the risk and dangers of prescribing opiates. In addition, doctors must support and use medication assistance therapy, which has proven to be successful in keeping people in treatment and lowering both the morbidity and mortality rates associated with opiate use. Moreover, doctors should immediately call for the support of universal prescription drug monitoring programs to prevent the occurrence of addiction and abuse, so people can't cross state lines to get an early refill or use a completely different doctor in another state. Doctors must support and use alternatives to treat pain, which do not have the same addictive properties that opiates do and are much safer to use. Therefore, doctors must support and prescribe the use of marijuana and other non-opioid pain relief drugs. To end the opiate epidemic in America, doctors must take a compassionate approach that addresses both the medical and non-medical use of opiates. If doctors want to save lives, prevent addiction and disease, they must use and support coordinated care treatment, medication assistance therapy, strict opiate prescribing practices, a universal drug prescription monitoring program, and a non-traditional approach, as well as alternatives to treat pain. To dispute past claims that opiates are safe, doctors must be required to take classes on the history of opiates and the consequences of prescribing opiates. Every day, more and more people are dying from opiate overdoses. Therefore, doctors must take immediate action to end the opiate epidemic in America. Does anyone have any questions, concerns, or thoughts regarding my speech or the topic discussed?